edition of Motherhood Uncorked. I'm Courtney, your host, and I'm here this week with Care.
Hello.
Care is a mom of 4, and she is also a registered midwife and parent educator.
Yeah.
So she is here this week to talk to us all about baby-led weaning.
Yeah, so starting solids. It's always a big moment for all the parents out there.
Exciting and also a little bit scary too.
Yeah, it can really be scary for parents, especially when they've got so many questions, they don't know who to turn to, so much information online, things are changing.
Everything you need to know is going to happen right here.
That's right.
For baby-led weaning.
Exactly.
And purees a little bit too.
Yeah.
All right, here we go. Woo! All right. You want to pass me over your glass?
Should have worn my leather pants too.
Matchy. Cheers. All right, so why don't we just jump right into it? And I guess maybe some people haven't heard of baby-led weaning as of yet. I know it's a really trending topic, so most people probably have, but what are the differences between traditional purees when it comes to starting your baby on solids and baby-led weaning?
Yeah. Okay, so baby-led weaning, in the UK, the term weaning just means additional complementary food, which can be a little bit confusing here in North America because we hear weaning and we think stop breastfeeding, stop bottle feeding,
Right.
Which is not the purpose of it. And so really here in North America, we tend to call it baby-led feeding, just so people understand that we're not, again, stopping that nutritional need of the baby of having their breast milk or their formula. That is the main component of their diet.
Right.
But the nice thing about baby-led feeding is that it's self-directed. So instead of being parent-led, where the parent is feeding the baby on a spoon, the baby is actually picking up objects that are a safe shape and a safe texture and feeding themselves.
Okay, so with traditional purees, people generally start feeding around 4 to 6 months. When can you start the baby-led weaning or baby-led feeding? I guess we'll call it
either, whatever you want to call it, it's interchangeable. Generally, the recommendation actually is for all starting solids that we start 6 months and beyond now.
Okay.
So Health Canada and the Canadian Pediatric Society have a joint statement together where they say 6 months and beyond is really the ideal time to start solids, no matter how we're starting.
Okay.
Having said that, some babies will be ready slightly earlier or slightly later. It's not like some buzzer goes off when they reach that exact age.
Time to eat.
Exactly. Oh, I'm ready. But having said that, if we are choosing to start earlier, typically if someone's starting at 4 months, a baby is going to be developmentally more in the place of being more appropriate to have pureed food versus feeding themselves. Having said that, there are some babies that are ready before 6 months to do baby-led feeding who have just developed a little bit quicker than others. But what we're really looking for with baby-led weaning or baby-led feeding is a nice sturdy baby who's got good head and neck control, able to hold themselves up nice and strong so they're not slumping down in their high chair or curving their airway.
Kind of flopping around.
Yeah, no, sitting up in a proper high chair, proper booster seat. Again, we don't want that curvature of their airway that could contribute to them being more likely to choke. We want to make sure, again, that baby's showing us that dexterity of bringing things to their mouth, so showing us they're interested. We want to see that they've got that loss of their tongue thrust, which is actually present when they're first born. We want to see that they're looking interested and kind of engaged in our food.
So the tongue thrust is kind of when they push the food right back out of their mouth and they put it in.
When a newborn baby is born, they kind of do this constant where they lap their tongue out. That tongue thrust is present typically until about 3 to 4 months, and it's really our baby's body's way of saying, nothing else in here, I just take liquids.
Okay.
From about, the time that starts to go away and starts to subside, that's one of the first signs that they're starting to get ready for solid foods.
Okay.
But the loss of the tongue thrust alone would not be a reason to start solids.
Okay.
We'd be looking at, again, what's their age, what's their development looking like, how has their gastrointestinal system been working? Are there any extra considerations for this baby, special needs or anything?
Okay.
But typically with both methods, we're going to be starting around the 6-month mark.
So what are the benefits then to going the baby-led feeding route rather than doing the purees?
Yeah, there are a lot of benefits. So for us as the parent, it's less work. So it's less work to have to, versus preparing purees and freezing them and getting a baby bullet and doing all these things where you're kind of going to all the extra work. Really, you're creating a healthy family meal and you're making sure that you're preparing a portion of it in a really safe way.
Okay.
So that's a really nice long-term benefit I see for families. Some of the other benefits, though, immediately in the moment for the baby are that it's increased chances for their development or for their dexterity, to develop. So if a baby is doing things like having lots of practice bringing things from their hand, from the plate to their mouth, their hand-eye coordination is improving. Over time, they'll go from that palmar grasp to having a pincer grip. So they'll actually refine that dexterity.
Okay.
They'll actually go from just having a lapping tongue to being able to do something called lateral movement of the tongue, where they can actually move their tongue from side to side within their mouth to move food over to either their gum line or the teeth line. We don't actually need teeth in order to do baby-led feeding, which a lot of people think.
Okay.
We just need to have a baby who's developmentally ready and a baby, again, that we're giving appropriate textures to so that they can move those over to their gum line to kind of be chewed and taken care of.
Right, and it's soft enough that you don't need a teeth, you know what I mean? We're not giving them crackers where they need to crunch them all up. It's soft enough that they can use their gum to kind of mush it down a little bit more to be able to swallow. Exactly.
So what we're aiming to start with, typically with baby-led feeding, is something that's cooked or prepared in a way that is a size that our baby can grab with their palmar grasp. So that's usually in the UK, they call it French fry size because they've got those big fish and chips.
Right.
So kind of a wedge. But here in North America, we think of French fries as these little, skinny things. So again, we're looking for a larger piece that they can pick up. And over time, they will learn to be able to adapt to smaller things. But at the beginning, it's going to be larger. And when they bring it to their mouth, we'd like the texture to either be so soft that they can just kind of easily gum through it, swallow it down, or gag it up because it's nice and soft. Examples of that would be like a really nice fork tender cooked carrot, a very, very ripe banana, a very ripe avocado, cooked sweet potato, so things like that. So then the other side of the spectrum is that you can start with something that's very firm and hard, something they cannot bite through. So an example of that would be, we would take, for instance, a pork chop, cut off the vast majority of the meat and just leave a little bit along the edges. And our little one could pick up that pork chop bone and kind of gnaw along those little pieces of meat.
Like a little Viking.
Exactly, a little Fred Flintstone. So it would seem like it's almost like they're just getting almost like the shredded pieces, like how you could shred meat also for a little one to give them in a safe way. But it allows them to kind of pick it up. Now, we'd never want to replicate that with something like chicken bones or fish bones, but with something like a nice kind of pork bone, that was a good one, and my little ones would kind of gnaw on that. And that, again, gives them the practice. So that can be a nice option on the other end of the spectrum. Over time, as they learn to chew and then swallow their textures really well, then we're going to kind of meet in the middle, and we're going to kind of start to get them on all the different textures. Well, that will take a little bit of time.
Okay. So is baby-led weaning or feeding for everyone? Like, will it work for everybody, or are some babies just better off starting on purees, and how do you know?
Yeah, I think, I'm always someone who says, like, there's no one way to do it, almost anything. Every baby's different. Their temperaments are different. I've had parents say to me, I'm definitely doing purees. There's no way, I'm just doing spoon feeding. And then they're like, my kid won't let me. I've had parents say, I'm doing baby-led weaning. That's what I'm doing. And their child doesn't resonate with it. Well, we've got to follow our little one's lead. So I do encourage you to really, see what your baby's like. I encourage you to try it out. Giving them opportunities to self-feed definitely encourages them to do it more.
Okay.
And so I think it's always kind of worth a try, but I definitely am, again, always someone who says, do what's right for you and your individual baby.
Okay, so what can you expect when you start besides a mess?
Yeah. Yes, a large mess. I encourage you to put down a drop cloth if you've got a nice carpet or anything. Go with like an apron bib, or strip down your baby to something like just their diaper, and just so you can clean them off easily. But what you can expect at the very beginning is that in some cases, kids will take to baby-led feeding or baby-led weaning so quickly. They will literally just want everything that's given to them. Typically, we're giving kind of one object at a time so we don't overwhelm them, but some of them will take very quickly to food, and we'll want to progress through that kind of initial period of food progressions where we're taking them through each individual item quite fast. Others, it will be a very slow progression. Some will actually only put food in their mouth and kind of move it around and then kind of spit it out.
That was my son.
Yeah.
For until he was probably 10 and a half, 11 months is when he actually started to eat the food.
That's actually pretty common. So a lot of babies up until about 9 or 10 months will just kind of put the food in and experience it orally and then spit it out. Or they'll kind of lick small amounts and taste it. Now, if we're concerned about if our pediatrician or healthcare provider has any concerns about our baby and their well-being, if they weren't gaining well in their breast milk or formula, it might be a time that we're intervening more. But in many cases, babies are getting the main nutrients from that breast milk and formula, and we're adding in these complementary foods. And so we don't need to be in a huge rush to force them to eat a certain amount at a certain time.
Okay.
Of course, if we've got a concern about our individual baby, always bring it up with our healthcare provider or reaching out to someone like myself to help you along the way. But I think it's important to note that we don't expect them to kind of have food and just, oh, I know how to do this, and right away they're off to the races.
So at what age does the breast milk or formula stop being kind of their primary source of nutrients, and you kind of want them to get more of the nutrients from the food that they're eating?
Around the 1 year mark, we're looking for our babies to kind of be on typically about 3 meals a day and some snacks. And so usually that period from 6 months to a year is where we want to kind of go from having the 1 trial meal a day to eventually kind of 2 meals a day, and then eventually 3 meals a day. These might be small meals, but we want to make sure they're really nutrient dense, so that the food that they are getting is really helping their body and helping them develop and grow properly.
Okay. So can you kind of do both? You kind of alluded to that you can, but can you kind of do purees and allow your baby to start to self-feed as well? Or will the baby just kind of revert to, I want to be spoon-fed because it's easier?
No, you can do a combination in some sense. We just want to be a little bit careful, because what we're doing is with baby-led weaning or baby-led feeding, the baby's taking in the food to the front of their mouth and they're learning to chew that food before they swallow. When we're parent feeding a puree, our baby is learning simply just to swallow what's put into their mouth.
Okay.
So what we don't want to do is, for instance, give a baby, yogurt and it's nice and smooth and we're giving it to them in a spoon, and then one day we throw blueberries in there. Well, that's not safe. That baby's not prepared for that texture and isn't yet aware of how to chew and then swallow. So if we are starting with a puree route and we want to do like liquefied purees with breast milk or formula in them, nice and loose and kind of smooth, then we would typically recommend that if you're starting with those, that's only for a period of about 1 month. Okay. By 7 months old, we'd like more of a mash texture, or like a thicker texture to be incorporated in. And by about 9 months, our baby should be self-feeding. Okay. Now, if we're choosing to start with baby-led feeding at around 6 months, then our babies can still enjoy things like yogurt. They can still enjoy foods that are smooth. However, sometimes we'll prepare those in a different way, like maybe we'll put them into a self-feeder, or we'll make them into, a yogurt energy ball with something. Or once they start getting good at their own spoon skills, they'll do that. Or if the food's thick enough, we'll let them just pick it up with their hands and make a total mess. Right. So it isn't necessarily that we're going to spoon feed them the stuff if they're baby-led weaning. We're going to try to encourage them to eat themselves. But having said that, if we need to use a pureed food pouch one day or something like that, those are available to us. We just don't want to be shocking a baby, especially who's learning just to simply swallow food, with suddenly something more solid. Okay. So if we are going the pureed route, we'd rather kind of puree, make them thicker into a mash and lumpy, and then eventually baby-led weaning. If we're starting with baby-led weaning, then we can be a mixture of things that are kind of a mash texture they can pick up, as well as something that's a little bit more of a solid texture.
Okay, so you talked about to get a baby to eat, 2 or 3 meals a day by the time they're 1, and to have those meals, because they're not eating a lot, because they're still learning how to get the food into their body, that they need to be really nutrient dense meals. Yeah. So we talked a little bit about, good foods to start with the baby-led feeding, but what are some good nutrient rich foods that we can be giving our children as they kind of get the hang of it?
Yeah, so it's really important that we are offering our iron rich foods right from the beginning. Now, that doesn't mean that it needs to be literally the first food they have. Often we're going through that initial introduction of those single items, and then we'll start incorporating more kind of meals together. But important to remember that iron is such an essential nutrient, and that our little one really does need that iron intake. So, often we hear things about using our baby cereals and things like that. We've got excellent sources of iron that are naturally available. Okay. So one of the ones I always recommend is steel cut oats. We can cook a big batch of steel cut oats at the beginning of the week, put them into our fridge in a container, and take a little bit out every morning, warm it up. I usually add about half a teaspoon of blackstrap molasses, which is a great source of iron also, to kind of boost it up even more. And then I add in some mashed berries. And those mashed berries are full of vitamin C, which helps our body absorb and use our iron properly. Versus if we're actually putting together our iron with our calcium, we can actively stop our body from absorbing and using that nutrient properly.
Okay.
So typically one of the things I recommend is that when our baby is on one meal a day at the beginning, we really want to look at the nutritional needs more in about a week. We're not going to be able to get an iron-rich food in every single meal because we're trying other things.
Yes.
But once our little one is on 2 meals a day, which for some will happen by 7 or 8 months, we really want to focus on one of those meals being very rich in iron. And then the other meal can be our micro and macronutrients, our calcium, our other things that we want to be getting them separated out.
Okay.
So typically I recommend, doing something like either steel cut oats, like I mentioned, or eggs or tofu or meatballs, maybe as their iron-rich meal of the day.
Okay.
And their other meal, once they're, getting the hang of things, could be something like a smoothie. So it could be filled with, a really great fat, a healthy fat. It could have some greens, which leafy greens are very hard for our babes to chew. And so putting them into something like our meatballs, shredding them very small into things like omelets, or again, putting them into something like a smoothie can be a great option.
Okay.
You can also put in that, fresh fruits. You can put in, things like Greek yogurt. You can put in, kefir, so something with a great active probiotic in it. Okay. You can use things like flax and hemp and chia. Those are all safe options with our little ones. And so I really do like this idea that we could have one kind of really iron-rich meal and then one that's packed with all these other great nutrients.
Okay, I like that idea. Yeah. And a smoothie can still be baby-led feeding because they're drinking it themselves and they're holding their own straw sippy cup themselves.
Yep, and if you make it really thick, sometimes if you put like something like avocado in it, depending on what you're doing that particular day, they can spoon feed it too, or they can pick it up because it's quite thick.
Okay.
So just making sure you're putting it in a cup that is not a full sippy cup, making sure it's got a proper spout without the gasket, because if that's in there, it will stop that thickness from going through. Yeah, but if you've got something that can take something thicker, babies often love it. And again, that's a great way to kind of combine a whole bunch of great foods for them all in one.
Awesome. Yeah. Okay, so 2 meals a day should be happening at approximately what age? Like what age should they be having 1 meal, 2 meals, 3 meals?
Yeah. So that is something that a lot of parents are confused about. It's like, how fast do I need to progress to those 3 meals a day? Every baby's going to be different, but a general kind of rule of thumb is that we're going to start with our 1 meal a day when our baby is kind of a sitting up baby. By the time they're starting to crawl, they typically are going to need 2 meals a day. And by the time they're starting to stand, they're typically going to need about 3 meals a day. That's usually that we're starting around 6 months with 1 meal. By about 8 months old, they're having at least 2 meals a day. And by about 10 to 12 months, they're having 3 meals a day. Okay. Now, again, that's not perfect for every baby, but it's just a general guideline that we can look at. But always, always the recommendation I give you is that we don't move on to a second or third meal unless the baby's gastrointestinal system is doing great. Okay. So if they're having, constipation from the food or diarrhea, or there's something else going on with that, some kind of intolerance, let's get that sorted out before we go and add more and more and more.
Okay. Yeah. Okay, so then what about high allergen foods? Like what I've been researching and what I've been seeing is that you don't need to delay giving them things like peanut butter and eggs. In fact, these should maybe now be the first foods that we should be introducing them to?
Yeah, it's pretty interesting. There has been a big change, and I will always admit that this could flip-flop back.
Next year could be totally different.
Exactly, and I always admit that to the parents I teach because it can be really infuriating when you feel like you've just got something and then someone's like, oh, actually, the newest research says, and you're like, oh. So right now, we're currently recommending that we do start with our high allergen foods at 6 months and progress through our high allergen foods, giving them every week to our little ones. Some high allergen foods are not going to be given as readily, things like shellfish. The main ones that we're focusing on are mainly our nut butters, our wheat, our dairy, things like that, if we're incorporating those. Now, the one thing is that, again, we used to say delay, 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 and now the research is saying earlier introduction is better. The thing that we want to remember, though, is that when we're introducing things like nut butters, we need to do it in a safe way. We want to make sure that we are giving them in a way that they're not too sticky. They can get stuck to the roof of our mouth. They can be very difficult to clear off of our palate. Okay. So what we don't want to do is give our little one like a spoon of peanut butter or almond butter or whatever it is. We'd like to either spread it thin on like a lightly toasted piece of bread, or on a whole grain pancake as they get older, or something like that.
Or a smoothie.
Or a smoothie, you can put it in, exactly. It'd be a great source of fats. Now, if you're starting at the very beginning, let's say you've got, your 6-month-old and you're doing spoon feeding. Well, it's very difficult because we're not going to give them a spoon of peanut butter, like I said.
Right.
But we could take that peanut butter and put it in with a small amount of warm water and just kind of make it smoother. Put it in something like yogurt or a soup or something again. As long as the things that we're giving them, we know we don't have an issue with yet, because we do not want to pair together any of our high allergen foods within a few days of each other.
And then not know which one causes
exactly
problem, if there is a problem.
Exactly. So currently, when we're starting with our low allergen foods like potatoes or bananas or avocados, you know, we can feed one of those each day and we're not too concerned.
Right.
But when we're talking about the high allergen foods, we'd like for 3 days for you not to introduce another high allergen. Okay. So if I want to do nut butter today and tomorrow I'm not going to do eggs, but I could do a cooked carrot, or I could do potatoes or something like that. So again, just keeping those high allergen foods at least 3 days independent on their own, just so we can really see if anything is showing there. Most of our life-threatening reactions will show very quickly, but we just want to keep an extra close eye.
Okay, here comes my next question. As somebody that has a lot of anxiety. What do you do if there's a life-threatening reaction in your infant? Like, how do you handle that? You're obviously not going to have an EpiPen handy unless you have an older child who has one.
Exactly, or unless you're at like a facility that happens to have one. Right. So I'm actually a CPR instructor also. I teach this very regularly. I teach this all the time. So it doesn't matter if we're talking about a little one or anyone. At any age, a life-threatening allergy can come up. And that's so important for people to know. It's not just starting solids that's an issue with that. But if we do start to notice, typically the first signs of a true anaphylactic allergy will be hives. Not always, but that's typically one of our first signs. And those would be like a blotchy red splotches all over the face, neck, and chest typically that have like a little white center to them. Okay. And usually those would start, and they can radiate down the rest of the body, but they typically are starting in this area. If we are seeing hives, we want to stop giving our baby whatever that food is. Okay. Keep our phone close by in case we need to call for help, and monitor them for a few hours. Okay. If it ends with just hives, we're going to follow up with our baby's physician. So whether that's our pediatrician, our family doctor, to arrange for allergy testing. Okay. But if it goes beyond hives at all, or if someone has a known allergy already and shows any signs, then we immediately call 911. Okay. Typically, the signs that are life-threatening would be swelling of the face, neck, or chest. Often lips get very swollen, or eyes and stuff kind of look sad and tired. Sometimes that can be difficulty breathing or speaking or hearing, because that's swelling within our cranium, so within our skull somewhere. And so if we're having any of those symptoms, we would call for help urgently. And if we know it's life-threatening, we could give some liquid Benadryl if we had it, or if we had an EpiPen available, we could use that. And that's a one-time shot of adrenaline that would be given into someone's thigh. Okay. Yeah, so really important that we know those signs and symptoms and how to act. There are other food allergies that our little ones can have though, so not just anaphylaxis. There is one that's called FPIES, or FIES it's often known as, and it is a food protein induced enterocolitis. And basically what that means is that a certain protein within the food causes constant projectile kind of vomiting or diarrhea in the infant. Okay. Now the difference with this one is that this is not usually an immediate response. This is usually 4 to 6 hours after ingestion of the food. Okay. So it's a delayed response, and it's not just the baby is spitting up, or, you know, that food didn't agree with them, and so maybe they throw up once or something. We're talking like exorcism. This is non-stop vomiting, non-stop diarrhea. It can actually put a baby into shock. It can be very dangerous. It's quite rare, but just important for parents to know that if something like that is happening, you know, several hours after they've started a new food, to always kind of investigate and to monitor our child very closely in case we need to take them in for a little bit more help. Okay. Now, are there any foods that you should absolutely avoid when you're introducing foods? Yeah. So the main ones obviously are our choking related foods. Right. So those would be like hard, round, firm objects. So things like grapes and cherry tomatoes and grape tomatoes and cherries and, you know, all of those kind of small round things, nuts. We would keep away from them. If we were going to give them something like grapes or cherry tomatoes or grape tomatoes, we'd have to peel them and slice them into more than 3 or more pieces. So not just in half. It's a lot of work. So I typically say wait for a little while for those ones, because there's no nutrient in grapes that you absolutely need in the first few years of life. They're delicious though. Yes, they are. And tomatoes you can have in lots of other ways, so we're not worried about that. Right. But some of the other things that we 100% need to avoid are things like our honey. The concern with that is botulism. Okay. So that is a certain type of spore that can affect our body and can actually stop us from being able to breathe, things like that. So Botox, what people use for Botox, that's botulism. Okay. It can cause paralysis though. And so in a small baby, if their gut wasn't kind of prepared and they did come in contact with botulism, which is, rare, that could be a concern. And so that's why our honey is still listed, even when cooked or not cooked, is technically something that we're not supposed to give to our little ones under the age of 1.
Okay. And after 1 year in the clear?
Yeah, after 1 year, fine.
Waiting a little bit past 1?
No, and you know what? Even like when I've spoken to people at Mother Risk at Sick Kids Hospital, they've said the vast majority of 6-month-old babies have a very robust immune system and would be fine if they came in contact with botulism. The problem is that we don't know from looking at a baby which one's immune system is, great and which might be a little bit slower to develop. And so since we can't tell from the outside, we just kind of do it as a blanket statement.
So 1 kind of is kind of the safe,
exactly.
extended age.
Yeah. Like again, it probably would not harm a lot of babies if they were given it. By accident, your little one gets it and they're fine, don't worry.
Or if you've accidentally given it to them in the past and you didn't know this.
Yes.
Just stop.
Yeah, don't throw the baby out with the bathwater. It's okay. But generally, that is one of the ones that until the first year, we prefer that we're not having honey given to them.
All right. Okay, so this has been super, super insightful. I guess if I have more babies, I'm going to be on the baby-led feeding train.
Awesome.
Typically, I've been like, I just want to get you to eat, so I'm gonna spoon feed you because I'm always in a rush for absolutely no reason. I never have anywhere to be, but I guess it's just you like things to be moving along. But it sounds like it's more beneficial to if the baby is willing to learn how to feed themselves. I guess they would also be able to self-regulate when they're feeling full as well.
Yeah, it's a great lifelong skill. I've had several like nutritionists and dietitians who have said, oh, but they're not getting as much right in this moment as if I pureed and spoon fed them. That's true. But in this moment when they're learning to self-feed and when they're starting solids, they have breast milk or formula as that kind of extra nutrients. And I would prefer that a baby is learning to take in more food in this period versus being forced to eat in a way that they don't enjoy, and then their pickiness or these issues coming out in toddlerhood when they're probably not on the breast or formula anymore.
Right.
So to me, it's almost like in this period, I would prefer that this be the time that maybe they're not meeting every other requirement out there because they've got that available to them. Versus when they're toddlers, they will just be out there with no other source of that nutrition. And if they've become very picky because they haven't learned to kind of self-regulate in what they've enjoyed, that can be a larger issue down the road.
Interesting. So maybe all of our picky eaters are because we force them.
Well, there is some limited research that does look at baby-led weaning and the impact on lifelong enjoyment of food, eating disorders, things like that.
Overeating.
Yeah, I mean it's limited, but
super interesting.
Yeah, it's very interesting, and even just the idea that if we are choosing to parent direct spoon feed, remembering that we don't force a spoon through pursed lips. We offer food. It's kind of like the 80-20 rule with a kiss. Right. You lean in for a kiss and they lean in. You don't just attack someone's face.
Right.
Same thing. We bring the spoon to them, and that last 20% can be them going, ah. And if our little baby's turning their head to the side or declining food, they are allowed to say no because their brain is telling them, I'm all done right now. And what can happen is if our baby's body is signaling them, I'm done, but then mom or dad or whoever their parental figure is saying, no, keep eating.
You only have 2 more bites left.
Yeah. Over time, their brain actually says, you know what, you're right. We'll listen to this person instead of our body. And we've got concerns about that as far as diabetes and obesity later in life. So definitely important to really allow people to follow their own satiation cue or cue that we're full, and allow them to decide how much food they need. Just like us, sometimes we sit down and we want an apple, and sometimes we want a 3-course meal, and our babies are the same.
Okay. All right. Good to know. So you can find the link to Kara's website where she has all of her different workshops and stuff listed, as well as you have some blogs and other great information on there about all different kinds of things when it comes to babies, not just feeding.
I've got some YouTube videos on baby-led weaning also and baby-led feeding, so you guys can check that out.
Okay, so I will link to her website, her YouTube channel, as well as her Instagram and any other social media that I can find for you in the description below, along with my social media channels you'll find down there as well. And make sure you hit the subscribe button, and I will see you back here next week chatting to another cool mom. Cheers.
Cheers.
Thanks so much for watching this video. If you liked it, please make sure you hit that like button, leave a comment letting me know what your biggest takeaway was, and share it with your friends. If you loved it, please subscribe, hit that bell to be notified of when I put out a new video, which is every Thursday, and hopefully I'll see you then. Cheers!